the hospital.
Recent studies suggest there may be a possible link between having COVID and later being at a higher risk for Parkinson's disease.
Researchers say the virus can aggravate brain cells similar to neurodegenerative conditions. Now a Covington woman is speaking out about what she went through trying to figure out what was wrong with her health.
Tiffany Pigeon Swoboda is a longtime breast cancer survivor, but what she faced in 2020 was even more unimaginable. Before anyone knew about the pandemic, she and her husband Ron and her mother all got sick. Ron was gone in 10 days. Her mom had a stroke, and Tiffany, who was working as a registered nurse, became her caretaker. How did you cope with all this?
It was like a place I had never been, and I was like, wow, this is hard, you know?
Tiffany's always exercised and focused on health, but soon something felt off.
I noticed that my arm, and then I'd walk and I'd say, it's not moving. And then this leg, I'd walk and it was ka-clunk, ka-clunk, ka-clunk around the house. And I would say, I don't know what's wrong with me. You know, this is so strange.
And fingers on one hand didn't move right. With more than a dozen doctor exams, followed by multiple MRIs and nerve stimulation tests, it remained a mystery. She gets very emotional when she remembers finally getting an answer. Last year, at only 55, she was told it was young-onset Parkinson's disease. Tiffany had a genetic test from doctors at Indiana University, and their conclusion was that her Parkinson's is likely from having COVID.
And she said, I am seeing this more and more. It's almost like an epidemic.
There's no cure for this neurological disorder, but the frequent doses of medication she takes is helping her symptoms.
I was so happy when I could click my mouse, put on my eyeliner, because I had sat there like this.
She also finds help from the ever-growing size of the Young-Onset Parkinson's disease support group.
So the group just from last June grew from 4, we're almost 30. I'm talking in their 30s, like the newer people are barely 40 right now.
Since the pandemic, Tiffany has contracted COVID 5 times and now wants others to learn the early signs of Parkinson's.
I'm hoping to capture anybody out there who doesn't have a very obvious tremor. If something's not right, find a movement disorder neurologist.
From the North Shore, Meg Farris, WWL, Louisiana.
So to find out more about support groups, we do have a link to connect with Tiffany in this story on WWLTV.com.